This Enemeez 283 mg per 5 ml Enema Laxatives is designed to help with occasional constipation. It contains docusate, which is a stool softener that helps the stool to absorb more water in the gut, making it softer and easier to pass. After using this product, you can expect to have a bowel movement within 2 to 15 minutes. It's important to always check the ingredients on the label, even if you've used the product before, as the manufacturer may have made changes. Products with similar names may also contain different ingredients for different purposes, so using the wrong product could be harmful. The recommended daily dosage and optimal timing for taking this laxative will depend on your individual needs, so it's best to consult with a healthcare professional for personalized advice. This medication is only for use in the rectum. If you are using the over-the-counter product to self-treat, make sure to read and follow all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before and after using this product, make sure to wash your hands. Twist and remove the tip. Lubricate the tip of the bottle and the rectum with lubricant or the liquid before inserting. Lie on your left side with knee bent, or kneel and lower your head and chest forward until the left side of the face is resting on a surface with your left arm folded comfortably. You may also administer it while seated on the toilet. Gently insert the enema tip into the rectum up to the shoulder of the tube with a slight side-to-side movement, pointing the tip toward the navel. Squeeze the tube until nearly all of the liquid is inside the rectum. A small amount of liquid may remain in the tube after use. Remove the single-use tube from the rectum and discard properly. Only use this medication when necessary and do not use it for more than 1 week unless directed by your doctor. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. It's important to note that rectal irritation, burning, or itching may occur when using Enemeez 283 mg per 5 ml Enema Laxatives. If these effects persist or worsen, it's best to inform your doctor or pharmacist right away. However, it's also important to remember that if your doctor has prescribed this medication for you, they have weighed the benefits against any potential risks. Many people who use this medication do not experience serious side effects. That being said, it's crucial to notify your doctor immediately if you experience any serious side effects, such as rectal bleeding. While very rare, a serious allergic reaction to this drug may occur. If you notice symptoms such as a rash, swelling, severe dizziness, or difficulty breathing, seek medical help right away. It's important to keep in mind that this list does not cover all possible side effects. If you notice any other effects not mentioned here, it's best to reach out to your doctor or pharmacist for further guidance. As for concerns regarding the optimal timing and dosage of this medication, it's best to follow your doctor's instructions. The timing of when to take this medication can vary depending on your individual needs, so it's important to consult with your healthcare provider for personalized guidance. Before using Enemeez 283 mg per 5 ml Enema Laxatives, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. If you have any health issues such as rectal bleeding, severe abdominal pain, nausea, vomiting, or sudden changes in bowel habits over the previous 2 weeks, be sure to consult your doctor or pharmacist before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the medications and products you are using. Also, let your doctor know if you are pregnant or breastfeeding, as it is unknown if this drug passes into breast milk. Always consult your doctor before using this medication if you are pregnant or breastfeeding. As always, it's important to talk to your healthcare provider before starting any new medications. When taking Enemeez 283 mg per 5 ml Enema Laxatives, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This includes not only prescription and non-prescription drugs, but also herbal products. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is mineral oil. Always consult your healthcare provider for any concerns regarding potential interactions. If this medication is swallowed, it can be harmful. If an overdose occurs and serious symptoms such as passing out or difficulty breathing are experienced, it is important to seek medical assistance immediately. In the United States, individuals can contact their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Always seek help if you or someone else experiences an overdose of this medication. It's important to keep all medical and lab appointments when using Enemeez 283 mg per 5 ml enema laxatives. To prevent constipation, it's also recommended to eat dietary fiber, drink enough water, and exercise. This medication should only be used for temporary relief of constipation and should not be used for a long period of time to prevent becoming dependent on laxatives. Remember to follow the recommended daily dosage and consider the optimal timing for taking this medication. Enemeez 283 mg per 5 ml enema laxatives are used to treat constipation. They work by softening the stool and promoting bowel movements. This medication is typically used and other medications or treatments have not been effective. The recommended daily dosage is 1 enema, and it is best to use it at the same time each day for optimal results. It is important to follow the instructions provided by your doctor or pharmacist for the best outcome. Make sure to check the storage instructions on the package before using this medication. If you're unsure about how to store it, you can always ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it down the drain unless you've been specifically instructed to do so. Instead, make sure to properly dispose of it once it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.